Honorable Sir Professor Jo Beaufort. She is now working as a secretariat for the International Society. She is a leader for the International Society for Urban Health, and she has been working in this area for a long time. She was earlier the president for Academy of Medicine, which was earlier the secretariat for the International Society for Urban Health. And she visited several times in Bangladesh, especially in 2015 international conference on urban health. So, Joe, let me introduce with our honorable minister. He's now working as a minister for the local government in our country, a member for the Kumilla 9. And in 2019, he appointed as the Minister for the Local Government and Rural Development. Mr. Islam was elected as the parliamentarian in 1996. He was appointed as the member of the Standing Committee for the Home Ministry in 2000. He was elected to the parliament for the Kumilla 9, 2008, as well as 2014 as a Bangladesh Awami League candidate. He served Committee of the Power and Energy. Sir, do you like to say something to Jo Beaufort?
I think your internet line is not properly working. Yeah, right. It's dropping sometimes.
I hear you very well, Minister.
So
it's a pleasure to meet you.
Okay, same to me. Thank you. This is a nice pleasure. We can interact about that.
Likewise.
Yeah, right.
So can I start by you to give a introduction about the International Society for Urban Health, what you're doing, and as COVID is a pandemic in all over the country, world, Bangladesh is also suffering, a big problem about COVID, and personally, I feel that this is some sort of urban health related problem because most of the people affected in the country, people. Nowadays, it is spreading to the rural areas too. But social determinants say that an infection. When you look at the spread over the country, we found that this is the urban people the most are infected. So, what is your understanding of this COVID-19 globally as an urban health problem?
Yeah, I would. You'd like me to go? I would certainly agree with you. I think the International Society for Urban Health, is a global organization with very balanced involvement of the global North and global South. As Dr. Chalukdar said, we had a meeting in Bangladesh, our annual meeting in Bangladesh in 2015, and what we do really is working with UN Habitat, working with WHO, really trying to advocate for attention to urban health issues. And as we're not a direct service organization, although we do have specific program projects on youth in secondary cities, working with the Botnar Foundation in 2 cities in Africa and 2 cities in Colombia. So our sense of our effort to really understand what's going on, I would say that cities are very actively involved in collecting knowledge from their experience in trying to address COVID globally. UN Habitat and WHO are both doing, case study collections to look at how the city handled the epidemic, looking to share information about issues in various sectors like transportation, like housing, et cetera. And I think there will be, going forward, a very good basis and increasingly online basis for cities to look at the issue. But clearly, because of the concentration of population, I think urban environments are being the ones that are most visible, and obviously the first ones that are experiencing these problems. The biggest issues, it varies by city, but I think the biggest issues tend to be the economic collapse, in a sense, if the city tries to shut down to provide the appropriate health measures to decrease the epidemic. Housing is another big issue because of crowding in housing, especially with poorer populations and inability to socially distance. Food availability is a big issue that's emerging globally. And then I think transportation, especially where there's a dependency on mass transit and how one sanitizes and protects the population so that people that are continuing to work can get to their jobs and people can get around is a big issue. The only positive that seems to be coming out in our conversations are that because of the reduced use of cars, there are notable reductions in air pollution. But the question is, will this be sustained when people get back up? So I would say those are the major highlights from our networks of urban environments working on COVID.
Thank you. Let me, request to share his experience and his activities from the local government in the urban or for this COVID situation, how he is managing these urban health services for the general urban health people. Sir.
Thank you very much. Thank you, Madam Jo. Actually, I think COVID situation in the whole world, it is a new issue. And from the trial and error, global community is taking the decision what to do today and what to do tomorrow. So Bangladesh also, under the leadership of our Prime Minister, a comprehensive program have been taken from the day of COVID apprehension. So primarily, we try to contain this contamination within the some airport area, that is, they repatriate those who are coming from the outside. As because the COVID is not generated from Bangladesh, it came from the outside. So initially we were optimistic if once we can contain it within the particular area, that is the repatriate area, the airport area, so that maybe it will not be penetrated within the society and the community transmission will not be caused. So, but once actually after doing all these things, a lot of initiative and steps. Finally, on 8th March, we have identified a patient in Bangladesh, in Narayanganj area, some particular area of the Bangladesh. So after identifying this case, then whenever we identified several numbers of the cases, then the government have taken the decision for going the lockdown. And the whole nation have been locked down so that in the rural area and urban area, both where the strategy was that to remain the peoples in the home and in isolation and quarantine. Those peoples have an infection. They have to be they have to remain within the home. And the patient, those who have any severity symptom, then he has to be hospitalized. And hospital capacity, despite a lot of issues about this, that is actually as because Bangladesh also, like other country, was not prepared for handling of these kinds of a issue, and the people's perception was not clear about the COVID, actually what sorts of impact it will be cause in the society. So then, but facility in the hospital have been arranged, and the CP people have been taken shelter in the hospital, and that our doctors technicians and all the physicians, everybody tried their best to give their contribution for the rescue the peoples. And finally, we find that actually it have been spread to the whole over the country. And being a local government minister under the leadership of one prime minister, we have been instructed to involve all our local government entities. Like I think if you are known about the structural management system of Bangladesh, that is Union Porishad and Upazila Porishad, and there is a city corporation and Paur Sabha. So I engage all this our elected public representative to motivate the peoples, to award the peoples, and all this thing was done. And despite it that because many people on and sudden they have to migrated from urban to the village, so they have lost their job maybe, or even after that not losing the job, but their income generation or the source of the income have been dropped. So government have taken the initiative to reach their food at least to the every common people's house. So this job was done by our local government entities representatives. And beside that, you see there was the health issue. Health side, actually, we have a community clinic in the village area. This is under the leadership of, under the command of the health ministry. There it is nicely set up, and as it is the brainchild, the project of our Honorable Prime Minister when she first time came in the power in the 1996. She introduced this Kaisawe Community Center, and this community center is the organization. Initially, they are serving the health issue to the people, serving the people. And in urban area, there is actually urban area, there is a discrimination of the people's classes. There is a high class people, there is a middle class people, there is a lot of lower class people, slum peoples, and the rickshaw pullers, these, that, many other people, those who are the low income people. So for these low income people and middle income and I think the rich people, high class people, maybe they are the fortunate people, they can they obtain their required health support from the private hospital, and sometimes they go abroad for the more better treatment. But middle class people, we have in urban area, we have especially all the city corporation, we have 12 city corporation. All the city corporation equipped with the government hospital. But there is maybe we could have some debate, maybe what extent it is sufficient. Definitely there is a question. So anyway, beside that, there is one primary health care. Actually, why the primary health care is taken one assignment, one mandate have been given to the local government ministry. So I am the minister of that company, and local government ministry, and this organization have a PU entity all over the Bangladesh, and especially in Dhaka, Chiting, and Chittagong. Beside all Dhaka, Chittagong, there is we have a Dhaka North and Dhaka South. Some entity is there, Narayanganj is there, Gazipur, Rajshahi, Khulna, Sylhet, Borishal, Kumilla, Rangpur. And beside that, there is some Paur Sabha is also incorporated within this. That is, the 23 district is covered, not fully but partially. 12 city corporation fully within the primary healthcare system is present. And 45 partnership area is there. Partnership that is sometimes the foreign, that is UNA and European Union, they are extending some support in terms of the know-how and the knowledge sharing and the process development, how could do. And sometimes they give also some finance. So all these things is going on. Actually, in COVID situation, I think one issue you have raised that actually we are concerned about the vulnerability of economy. Yeah, definitely there is a huge mismatch all over the world. And mismatch, that is somewhere more or less everybody was employed in somewhere else. They have a small shop, they have a trading business, that, many things else. But because of the COVID situation, they have lost their job, and their business have been shut down, and they have incurred huge loss, and the industry, it was shut down, and industrial activities was paralyzed, and employees, they have been migrated to the village, and after that they came back, but industrialists have incurred huge loss, and they have the huge bank borrowing have been developed. So in such a critical situation, government have declared a more than about $9 billion package rescue program for the actually for all the sectors, and it have given a, I think, some sort of the vitality to the economy and other activities. But anyway, but now that is people's in that there is a present situation is like this. Mostly peoples in Bangladesh are 70% peoples are living in rural area. Rural people's perception is that death rate and critical situation for the rural people is negligible. That is, very few people have been faced very serious situation. That is, he has to be hospitalized, and he have to take the serious treatment, ventilation, ICU have to be used, and sometimes they have to face the death. So this number is whatever number is present in the urban area, it is much more less in the rural area. So a psychological like motivation up to the rural people have been developed. Then this is the actual disease for urban people, not for the village people. So though there is a non-significant number infected people have been identified. So nowadays, actually, like all other world countries of the world, they have also phase by phase often, and all the activities, that is industry, more or less have been open. And so though we have been given the instruction, everybody has to maintain the health health code, and the health this barrier they have to maintain. So in Bangladesh, in the shopping area, and still the school and college and universities is not open. So, and today morning I have seen a debate in the USA. Then the President Donald Trump, he have organized a occasion where he have invited the guardian of the students and the teachers and other community people. They everybody has given their expression from their purview, and whatever they like to say, that actually the COVID situation maybe once ago, but the disease maybe we can face, but if the psychological damage could rise of our kids, those who are continuously last many months are remaining in the homes because of this isolation, and because of the loneliness, and because of this they could not interact anything, they could not mix their friends, and so this is why they lost some sorts of psychological syndrome could be developed, which will be the actually serious concern. So this is the same situation in Bangladesh. So I think Bangladesh it is a very densely country, and peoples are very laborious, and I believe these peoples are very hardworking, and they are very law abiding. And so then maybe there is a challenge. Of course, there is a challenge, but the same challenge in Bangladesh. But we are hopeful, being a minister and a member of the cabinet under the leadership of our honorable Prime Minister. We have a very we believe that we can overcome this situation in case once the vaccine came and the antidote have been introduced globally, so that but another thing is very fortunate for us. Our Prime Minister is Honorable Prime Minister Sheikh Hasina. The whole nation is so far, I think, is unified under her leadership, which have been proven this few days back, that once the ferry cutting season, ferry pickup, so that whenever there is no actually for ferry cutting and pickup, there is labor is a very serious shortage, and there is a apprehension of the flood and the water flow, so that all these ferry which have been, all the cultivation have been destroyed. But Prime Minister have called the students and local leaders and the public representative to cut the ferry by their own voluntarily and to pick up it to the home of the cultivator. And it is surprisingly, we have seen that all over Bangladesh, all the students of university, college, and schools, they have joined with the cultivator to cut their ferry and to pick up. So that it is one of the big symptoms. That is, once the Prime Minister gives a call, so then voluntarily many people or the many classes people will join in case of any bad time, any bad situation. So this is our one of the hope, then we can face this situation. Yeah.
Thank you, sir. Joe, just share with you that situation in Bangladesh. I'm just surprisingly, I like to add 2 points. Number one is when you look at that, infection rate among the slum people, we found that there is a very few number are infected. It is really surprise to us because, in Dhaka city, the people are crowded in the slums areas and they don't have that education to maintain the social distinction, as well as the lockdown they couldn't maintain, but still the number of slums people infection is the reason. But we found the recent survey conducted by the ICDDRB, there is surprising results. Found among the death, women death is significantly lower compared to male death. Like when 40 people died, among them like 33 people are male and 7 people are female. So there is a between male and female in terms of mortality. However, there is a still gap. Primary healthcare services in the urban areas, and at the beginning of the COVID, we had a lot of struggle. We had a lot of struggle to provide the testing facilities and other things. What is your experience in other developments? We know that New York was one of the most affected, areas in the USA. Yeah. How do you see that? Was affected in terms of managing the health system? Joe.
Yeah, I think you wanted me to talk about New York. Your sound's breaking up a bit. I would say New York City, I mean, one of the challenges, obviously, and the most visible challenge, I think, were the significant numbers. And then the other characteristic of New York City, New York State healthcare system is it's very hospital focused. So people were really directed to and choosing to go to hospitals to be examined, to have diagnosis. We also, because there was not a national mobilization on the issue of screening and testing and availability of testing, and that's still a problem in the United States, as has been pretty widely discussed in the media. The sort of flood of people trying to get their care in hospital was a problem. And I think in retrospect, now that there was the health workers were amazing. I think the level of technology, the decision making by the governor of New York, especially to have the healthcare delivery, the large hospital systems, which really dominate the delivery system in New York, work together. The creation of surge capacity in the hospitals really allowed, certainly over time, the medical care angle of things to get under control. I think New York was really one of the first, cities to have such an enormous number of people. So many of the clinical practices were really not well known. How do you manage these patients? When do you put people on respirators? What are some of the other medications that work? None of this was as clear, in March and April as it has become clear. And I think credit to the clinical community in New York, who have been really sharing their knowledge and their experiences across the country. And I think the hospital management of the most acutely ill patients has improved dramatically across the United States. What has been overlooked, but then again, it was not the strongest part of our system ever, is the primary care sector of our healthcare delivery system. And I think now, looking at our experiences during COVID, had there been more active consideration of the needs of primary care providers, for protective equipment, for testing, for screening equipment, they could have been a stronger participant and more helpful in preventing unnecessary hospitalization, and also, very importantly, sustaining care for non-COVID patients who have chronic illnesses that require ongoing management, like diabetes, cardiovascular disease, and others. So this has been a gap that in New York, I'll just speak about New York, people are now recognizing and trying to be sure that they are able for any resurgence, or that there is an ongoing effort to strengthen primary care. Another gap was in the public health infrastructure. Again, the tendency has been relatively less investment in local health departments and in public health capabilities around screening, around testing, around others. They have the expertise, but they may not have the numbers of staff needed, or again, the protective equipment, laboratory equipment, et cetera. So again, in thinking about the future, how do we be sure that the primary care sector and the local health departments are strong to contribute to, future pandemic or resurgence of COVID, and or just in general to rebalance our healthcare delivery system in New York, and I think to some degree across the United States. There has been, unlike the minister, and I commend efforts that have resulted in less spread in rural areas. I think we have seen the numbers are clearly smaller in rural areas because of the population density, but we are now seeing very significant outbreaks in some of the rural communities around the United States in terms of numbers of cases per population. So I think that because we have not really had the kind of national mandates that the minister described, I think there's a very, very high level of variability around the United States, among states and among the steps that they're taking. So the political belief that there should be considerable degrees of freedom in how states and local governments are tackling these issues, in my view, has been a problem in the United States. And I think most people feel had there been more national leadership and clarity, people would not have been as confused, and perhaps the numbers of cases and the preventive aspects of the work, screening and testing, would have been more robust. But individual states are taking those steps now and taking some of the steps that the minister has described. But I'd say on the healthcare side, attention to primary care, attention to local public health departments is something that's been an important lesson learned, in addition to hospital clinical practices, which I think are in pretty good shape now. Shamim, I think you're frozen. I don't know.
But I'm hearing you.
Maybe the minister should comment. I think he's not able to.
Moderator may be disconnected or not. I don't know whether he's. Mr. Shamim, are you in connection? Dr. Shamim? Is not hearing me. But he's
his screen isn't moving either, so I think he must have an interruption of service somehow.
So informally, we can discuss.
Yeah, I was interested his notion around low incidence in. Are you back, Sharif?
Yeah, you have a several visit about Bangladesh. You came back several times in Bangladesh.
Yeah, I was in Dhaka several times. I wasn't able to go outside of Dhaka, but I was interested in Shamim's observation about apparently low incidence in the informal settlements and slums. And I think that's a real concern across the world. Obviously, there are data problems in knowing what's going on, but I think it's an important observation. It'd be interesting to know what have there been particular steps taken, or if there an understanding of reasons for that.
Joe, stop. I just want to just my observation as well as understanding about the health system in Bangladesh. If you look at that, our honorable Prime Minister, she had started one global project called Community Learning Project in all over the country for the rural people. But when you look at the urban areas, I found that there is a two project is going on. One project under your ministry that is called Urban Primary Healthcare Project that is funded by the ADB. That is in Dhaka city, and some other Poro Shobha is covering their primary healthcare service. But I have a feeling that, sir, you may have a scope to extend and establish urban community clinic in urban areas for ensuring this primary healthcare service for the poor people as well as for the people of urban areas. Because day to day urban people are increasing, and we are expecting that it will be around 50% of the urban people in the next few years. So I have a urge to you to replace or to try to establish that Prime Minister dreams in the urban areas and starting the urban primary healthcare project. What is your understanding? How do you like to see this type of initiative in urban areas?
Yeah,
Mr.
you see.
Sir.
Yeah, right. Yeah, in Bangladesh, actually, rural area do not have these kinds of a composite medical facilities in the rural area. So in the that is Upazila level, that is police station level. I think if we say Upazila, in Upazila level there is some sorts of there is small hospital is there. But because there is a big gap for the population, for the rural people, so this is why the perception had been taken by our honorable Prime Minister to set up the community clinic. Actually, in urban area, you see there is a lot of hospital there, and privately and government owned, private and public both hospital is there. But once we have identified there is a good numbers of the peoples are the slum peoples, very poor people. They do not obtain always the right time on right service. They are not. They could not be. They could not take. So this is on that perspective. Actually, the government have take the initiative by the city corporation and the Poro Shobha in urban area to set up some sorts of the entities. And these entities, I think, okay, of course. Because pandemic situation, before pandemic and after pandemic, there is a lot of such. If I give you some instant, you see my home district is a Kumilla. Kumilla, there is a 500-bedded hospital. But I very on and sudden discovered there is no actually ICU in that hospital. So actually, it was not people take very seriously. As because the Kumilla and Dhaka is not too far. It is a 1 hour and 1.5 hours. But in private medical hospital, maybe some private medical facility, they have some sort of ICU. So intensive care unit. So once I have identified that, so out of the purview of me, I have given some sanction. I have the scope to give, and accordingly, they have provided there is 10 ICU unit. At a 10-bedded ICU facility in Kumilla hospitals, and there is only one PCR machine. That is PCR facility. One or two machine was in whole over the country, but now it is a situation is a more than 100 machine is all over the country within the soonest time. And the ICU facility have been extended and ventilation facility have been extended. Many things have been done. So before this pandemic, actually this COVID pandemic, so the government and the peoples and the business community and the health related business peoples also was not concerned about those issues. Today, I talked with one of the owner of the hospital. He told me the lot of machine he have been imported by year from anywhere of the world, even European machineries he have imported just to support the people. So this is a different scenario. And after that, actually, definitely we believe that in the slum people, for getting the slum support, slum people support, we are working for that, and we are mandated to work, and accordingly we are doing our job. And okay, it could be extended. Definitely, it could be better if we can extend it. And there is some other challenge will come. You see, in the Salah, because the this once pandemic go away, then this COVID situation go away. There is a lot of jobless and income. Actually, in case people's numbers will be rise, and definitely it will. And our you see in case of national issue, you see all industry was shut down and it was not working. So as because industry did not been produce anything else, they could not earn money. So how could they will pay their revenue? And import was shut down and stuck up, and export was not done. So there is a revenue or income already been definitely some sort of the impact will be on it. But our foreign reserve and our other sources, and as I mentioned earlier, that our peoples of Bangladesh is very committed and unified under the leadership of our Prime Minister. And once she called the peoples, then they will immediately they will join in the activities in anywhere else. And there is a one as a silent issue here for Bangladesh is very. I think it is a matter of pride. That is our agriculture. Actually, Bangladesh was food deficit country. You see, now there is even within the COVID, and we do not have the shortage of the food, and we have agriculture and other the vegetable fruits, and most of the fruits is growing in Bangladesh, and lot of educated peoples is actually doing this kinds of a garden where there is the fruits is actually growing. And so definitely, and beside that, we have a lot of fish. And you see, one fantastic thing is that once India have stopped to export or send their cow to Bangladesh, so people was very scared about the Eid al-Azha, how where from they will. And one season after that, this scenario have been said that our homegrown cow is such enough, then actually it not required. And the people is now, I think, demonstrating not to allow to come any cow from India because they have enough cow to sell, and the goats is here. So this is the very, you see, the last season global in the subcontinent there is a huge shortage of the onion. And now that is, I am hearing that the onion growth, the peoples have given the emphasis and given the importance. So they have produced the onion. So this onion maybe next time you will not require to import. So there's a lot of things is there, and this is a, despite this is very scared of the land, the huge population. I think the peoples is very committed about the once the prime minister give the call. And beside that, actually, that as we have discussed about actually rural area density of the Bangladesh is more or less is, of course, urban area is high, but rural area is density is low. despite it not this, there is our village is very green, lot of plants, trees is there. So then, and the air quality in the village is, I think, much more better. And the people, those who are living in the village area, they're taking the good air breathing, and they are taking the fish from their pond, and from their own sources, and agriculture, vegetables, whatever they're growing, all this is good for maybe health, for nutrition, and for immunity. So that I think immunity of the people, say somebody like to say the rural people's immunity is much more higher, and as because moreover they are working in the mostly within the sunshine, so their vitamin D deficiency is much more low in comparison to urban areas. So I think there is a lot of facilities. And okay, in concluding, I like to say in urban primary health care, actually, I am myself is working, and I think the next week we have a meeting with the project director who is leading the urban healthcare program. So and then we have taken a initiative to review the actually facility whatever you have. Madam Jo, I think you, as you told that you came in Bangladesh several times and you are engaged globally regarding the primary health care. So your engagement in Bangladesh, I would highly appreciate it. And sometime if you visit Bangladesh, then maybe physically you can sit together and we can discuss much more. And I think that as because you have a good experience from the global context regarding the primary health care and especially urban area for the slum people, so we can work together jointly as you love it. So I also love to join with you. Thank you.
Yeah, I would look forward to that opportunity especially to meet in person. I think that would be great for all of us, and we've enjoyed working with Eminence over the years, so they're a very important partner, I think, for primary care especially. Yeah. So thank you.
Yeah.
So I just want to add one point. Can you just a little bit share that as we did work with you earlier with ISUH for urban health development in Bangladesh, as well as we try to contribute for the global urban health issue. So as our minister shared that he's interested to make some sort of partnership with ISUH. So is there any scope to work together, like local government ministries and ISUH together for development and further extension of the quality of service in our country for urban health? Jo?
Thank you. As I mentioned, I think we have not our first efforts in ISUH has been more of a policy research, providing evidence for policymakers like the minister and program leaders like yourself, in terms of developing programs locally. But I think there certainly would be room for a conversation, certainly building on the community-based solutions working group of ISUH that you had established with a colleague from India, I think would be a good start. And I know there were a number of people from different countries that had been very interested in that work. So perhaps that would be a base for us revisiting the possibility of closer collaboration with Bangladesh and with your leadership in other areas where people are really looking at especially urban primary care services. So we can talk about,
I just want to share with you. Yeah. I just share with you that, under the leadership of International Society for Urban Health, there are 3 working groups, and one working group is community-based solution working group that is, run by the leadership of India and Bangladesh, as well as United States of Arab Emirates. So we actually run these 3 country's leadership for community-based leadership of urban health. So Joe just mentioned that that platform can be tried to establish and take forward this agenda. So if we get your support and your leadership to take forward this group, so we can try to engage other people and ensure the Bangladesh leadership for community-based solution group of the International Society of Urban Health. So we want your comments and suggestions.
Yeah, as I mentioned, that there is actually primary health care is present in Bangladesh in urban area. And we have been already given the explanation, and you know about the rural areas health facilities. So in all respect, actually, there is a policy support, there is a technical support, and there is some source of the medical support and economical support. So I think in various areas, there is a scope in Bangladesh to extend the cooperation and to provide the support. So I will appreciate the global community, Madam Jo, once they have according to her previous experience in Bangladesh, I think she is very well aware about the Bangladesh situation. So in Bangladesh context, if she can find out the way to join with us, and it will be highly appreciated from my part, and I will do my best because they are very concerned about the humanity. So Bangladesh still, we are fighting to reach the level of the middle income country. We have been recently graduated as a country. So still Bangladesh per capita income is about $2,000. So there is a lot of scope for the rich countries and the global communities to contribute for Bangladesh. I think once the peoples of Bangladesh could be scale up about their lifestyle, then they will be the cause of the actually asset for whole over the world. And world community also will be there is many ways could be benefited. Once the huge demography size, that is 160 million people, so we are living, and these peoples, everybody is very asset and they can contribute in global contest. And our people is very law-abiding and very peaceful, and they are once they are very have a good leadership, they could be ruled by the good leadership. Then they, I think, main challenge for the creativity, for the development, for the resilient good life, and they can contribute. So I think I appreciate it. Thank you.
Thank you.
So, as COVID is not going out from this country or globally, it is a projection that it may take long time to go out. So I hope that Urban Health International Society for Urban Health leadership is needed for the developing country as well as for the developed country too, as it is a mainly problem of urban health. So I'd like to hear your last statement. How do you like to take forward this urban health agenda globally by ISUH, as well as how we can next take forward the leadership under the leadership of our Honorable Minister Tajul Islam, and under the leadership of our Prime Minister Sheikh Hasina, as she wants to provide the best services for the people. What is your last statement for us?
Well, I think obviously we're very committed to urban health, and we're very convinced that the primary care sector, especially with significant community engagement, is a very important element in achieving urban health. So with our history, I know Bangladesh has been a global leader in maternal child health and many other areas. So I think we should explore the possibility of continuing actually the activity, and perhaps having a focus on urban primary care coming from Bangladesh as part of our work. And I'm very happy to work with you, Shamim. We've worked in the past together well, and also with the Honorable Minister to understand fully the initiatives that are being taken in Bangladesh, and then to see how they might be shared, and we might engage with other leaders in urban primary care globally.
Thank you, Joe. Sir, finally, I like to thank you from Eminence as well as a member of the International Society for Urban Health. On behalf of ISUH, I also like to thank you for your time and your commitment for the urban health. I know that you have been doing very good work for local government, and everybody appreciate your initiative and take forward all the agendas for the people, especially for the poor people. So we'll conclude this program by having your last voice for the people of our audience, for the people of the urban poor. Sir, your last voice.
Yeah, thank you. I especially give my heartiest thanks to Madam Jo, and she has explained her status and her actually the future planning. So I'm from Bangladesh. You can consider me as a good friend of you, and we both could work together for the humanity. This is my actually last word to appreciate you. Thank you very much.
Thank you very much.
Thank you.
So thank you, sir. Thank you so much. Thank you, everybody from Eminence. Joe, thank you. Thank you again, sir. Thank you for your kind time, sir. Thank you, sir.
Thank you. Bye-bye.
Bye-bye. Bye-bye. Bye-bye, Joe. Sometime
Bye-bye.
Yeah,
I hope so.
right. Thank you.
So long. Bye-bye.
Yeah. Thank you. Bye.